opportunity to know what it means to fight for health care and make health care. The point of these discussions is to make health care right for everybody. Now, I will tell you that being on Temple University's campus, I did invite Vice President of Temple University Health System, Calvin Johnson, but today he emailed me saying he could not make it. I've also extended 4 invitations to the president of the university, Ann Weaver Hart, as you know, who is in charge, the most executive person in the university. She also declined at least 3 times. So in this discussion, we just hope to make this clear to the layperson where the stakes are. We're living in a time where we have actually a U.S. president that is going to listen to the possibility of a single-payer healthcare system, and that's unprecedented in my lifetime, and many others' lifetimes as well. So I just want to continue the ball rolling and pick up where we left off before I begin.
Could you tell me your name?
Thank you. My name is Roan. I'm a graduate student, and it's important now that you mentioned to introduce ourselves before we continue. I'm a PhD student, 2nd year. Tell us a little bit about yourself. About me, my name is Roan. I'm a 2nd year PhD student in the Department of African American Studies here at Temple.
Roan, could you first, or perhaps our guest speaker would actually define and describe what single payer?
Yes.
Okay, you're going to.
Dr. McDonald?
Okay, and Robinson, he always mistakes me with McDonald.
I'm so sorry.
I'm Dr. Robinson, Lawrence Robinson. And just a little bit of my background. I'm a medical doctor. I trained in internal medicine, but I also did a residency in preventive medicine, general preventive medicine, and I have a master's in public health. And formerly, I was the deputy health commissioner for the city and did all of the chronic disease and health promotion programs until the mayor laid me off.
Which mayor?
No.
Okay.
Yeah, just a few months ago, they eliminated all health promotion and chronic disease from the city, but that's a whole nother story. We won't get into that. It's a big mistake. But I've been an advocate for this for many years. In fact, I've been an advocate for a single-payer universal health care, and I'll define it, what I mean by that, long before it was popular. And I have actually a very interesting story to tell about Arlen Specter. Arlen Specter had invited me to Congress on the issue of mammography for women. Now you may remember, 55 was the cutoff, and Arlen Specter had introduced a bill to lower the age of mammography for women. I had done a program with the health department in the National Guard in Fairmount Park called Operation Health. And we had 2 mobile mammography units. We had an arrangement with the Linda Creed Foundation to underwrite the screening for the women. And in a weekend, basically, we identified 36 women with breast cancer and followed them through biopsy and, and the stages of their treatment. I wrote a paper on it and looked at the demographics that were involved. Now, the evidence to support breast cancer came from a group of mammography screening for breast cancer, came from a group of women in Scandinavia. And my argument was that that group was not comparable to the group in the inner city. Because what I found from my studies that in the inner city, women got breast cancer at an earlier age, and when the breast cancer was diagnosed, it was diagnosed at a higher stage. Okay. So needless to say, we won that fight, and they lowered the age to 35 to pay for the breast cancer screenings. After I had finished giving my lecture, my talk, Arlen Specter asked me, he said, Dr. Robinson, what do you think the solution to minority health problems in America today is? I'm standing in front of Congress. So I said, universal single-payer health care like every other major industrialized country in the world, just like that. And so Arlen Specter said, thank you very much, Dr. Robinson. You can sit down now. Exactly. And then when I sat down, he said, we won't have that here in America. He said, that's rationed care, and we won't have rationed care here. Okay. Now, even up to today, when just a few weeks ago, when I went to his office, he still has this chart on his wall about when Hillary and and the Clintons tried to do some type of plan. And he's got all these boxes and lines pointing and everything, and he says it's bureaucracy and so forth and so on. You know, so they don't really support it. But what is it really that I'm talking about when I talk about, you know, these issues? Okay, healthcare coverage should be universal. What do I mean by that? Okay, let's take the Great Britain system, for example. You know, if you're in the United Kingdom, you don't need to have any insurance card or anything. And in fact, you don't even have to be a citizen or anything.
Right.
All you have to do is go to a facility and you're already covered. That's universal coverage. You know, even as a tourist, if I'm there even as a tourist, and I fall and break my leg or whatever, I don't need any Medicaid card or, you know, Blue Cross or IBC card or anything like that. I just go to the hospital and I'm covered. No bills sent to me. That's universal coverage. Okay, the other issue is, what does single payer mean? Well, single payer means that there is one source that pays for the insurance. Now, what do we have now? We've got a mishmash, multiple plans. You know, you've got Aetna, you've got HMOs, you know, you've got insurance plans with your companies, you know, you've got thousands of different people who pay for the health care. They don't provide any service though, but they, you know, manage the forms, and, you know, and so forth. It's the biggest business actually in the city. We were talking about this. You know, you've seen the tower that IBC has downtown, and they're one of the largest employers, you know, in this area. Big business, and yet they don't provide any actual care for anyone. That's Independence Blue Cross.
Oh.
Independence Blue Cross. That big building, that big tower downtown.
But towers in a number of major cities.
That's my point, yes. So that's the concept, you know, what we want to do, and see, the reality is that it doesn't necessarily mean that there will be just one payer, because quite possibly it may be regionalized. Because some people argue that, you know, a federal government plan should be regionalized, which they do already, like HHS, Health and Human Services, some of those groups, they're already regionalized. So they have regional offices that provide, you know, different types of health services. So that may be, but that would also fit under a single payer plan. But the basic principle is that the government, you know, is supplying the medical care. And the concept that is universal means that everyone is covered regardless of what their status is. Okay, some of the other issues. The care should be continuous. You know, one of the problems that we have now with our healthcare system is that we have episodic or non-continuous care, okay? You got a job one day, so you have insurance. You got laid off the next day, you don't have it. You know, and I don't know if anyone has looked at these COBRAs or things like that, these coverage plans. Now, I just got finished going through this, so I know it's ridiculous. It was $1,200 a month for a family for COBRA from the city. $1,200. Now, who can afford to pay that much money a month for health insurance? And you just lost your job. Very, very expensive, you know. And I mean, there are cheaper plans, but you know, the city had, you know, the best plan, which is, you know, where you pick your own doctor and things like that. There are some HMO plans or something that are cheaper than that, but they're still like $700, $800 a month, even the cheapest of all the plans, you know, for a family. So it's very expensive with health insurance. And so what happens is you find that you have episodic levels of coverage. So there's been questionnaires that have done, and they said, you know, they've asked people, you know, how have you been without health insurance in the last 5 years? And when they do those surveys, they find that a large percentage of the people, you know, have not had health insurance continuously for that amount.